Measles is one of the most contagious illnesses that we know of. If someone hasn't been vaccinated and they're exposed, have a close exposure to somebody with measles, they have a 90% chance of getting measles. So it's really contagious. Measles oftentimes is not diagnosed right away by doctors because the rash isn't present right away. And so sometimes people continue to be infectious and spreading it to other people and because they haven't even been diagnosed with it yet. So there are days before the rash occurs, and the rash is what eventually tells a doctor that it's measles. Measles can be very serious. I think people think of measles as something that's just a fever and a rash and everybody used to get it and what's the big deal. I think that's because people don't remember. It's been so many years since there's been lots of measles around. The many cases that we used to see of children that would develop brain inflammation or encephalitis or need to be hospitalized or even die from measles. People who think they might have measles, it's important for them to not just show up at their doctor's office or show up at an emergency room because they can potentially expose a lot of other people. So the best thing is if you think you or your child has measles, to call your doctor's office or call the emergency room first and say that you think you have measles or you think your child might have measles, and so that they can prepare for you to come in and make sure that you're not exposing a bunch of other people to measles when you come in to be seen. People who have received 2 doses of the measles vaccine don't need to be revaccinated. There are some people that received the early measles vaccine. It was first available in 1963, and the first few years that it was available until about 1968, it was a different type of measles vaccine. People that received that measles vaccine probably do need to be revaccinated. It's difficult to figure out whether that's you, because hard to find your vaccine records back from that long ago. And if you can't figure that out for sure, the safest thing is just to be revaccinated. There are concerns that among measles experts in the United States that measles could become endemic again, could be something that we have all the time in the United States. To avoid that, we need to be sure that people get vaccinated. We need to be sure that their vaccination rates across the country are high enough so that this doesn't happen. We know the MMR vaccine is very effective, it works, and it's safe.